As major donor countries turn their priority and focus on other burning global issues like wars in Ukraine and Palestine, as well as climate change, among others, Health Minister Dr. Jane Ruth Aceng has asked government to raise its own money to eliminate malaria, which is a public health threat. Aceng made the clarion call while appearing before the Parliament Committee on Health on Wednesday. The gravity of the situation has been echoed by Dr. Jimmy Opigo, the head of the National Malaria Control Division, who says that the withdrawal of external funding, which has for years supported critical endeavors, including malaria control and treatment initiatives, is unfortunate.
This has mostly been going to mosquito nets for prevention, residual indoor spraying, test kits for malaria, malaria treatment, both first line and second line, both in the public and private sector. Donors have been also subsidizing the private sector.
Dr. Opigo underscores that the bulk of the money is from USAID, the Global Fund, and the World Bank.
The cost of its control, the public health control, not what households do on their own, has been about 95% donor dependent. We have been receiving from the Global Fund every 3 years about $270 million. That is $90 million per year.
Despite concerted efforts, Uganda finds itself entrenched in the world's third highest malaria-burdened nation, trailing Nigeria and the Democratic Republic of Congo. The average annual economic loss in Uganda due to malaria is over $500 million, which is equivalent to 2 trillion shillings.
You know, through public-private partnership, government has made manufacturing of anti-malarials here by Cipla quality chemicals in Luzira. Also, government has attracted mosquito net manufacturing within the country, larvicides, and also their private sector manufactured larvicides. So in terms of capacity, it exists.
However, he regrets that Uganda's progress against malaria has been hampered by evolving environmental factors, including alterations in mosquito behavior.
Uganda has a lot of rains, a lot of greenery, a lot of water, conducive climate for mosquitoes to proliferate. Also, the mosquitoes found a way behaviorally and genetically to evade our controls. Okay. Also, the medicine started developing resistance, but the worst thing is the people did not do their part. They are given mosquito nets, they either don't use it or they misuse it.
Aceng told Parliament that 85% of the Health Ministry's budget is funded by foreign donors. Walter Mwesije, NTV.